On this week's edition of New York Now, a special look at the state of mental health in New York in the wake of COVID-19. Experts say there's a mental health crisis coming, but is New York ready? We'll ask Assemblywoman Aileen Gunther, who chairs the Assembly Committee on Mental Health, and Glenn Liebman from the Mental Health Association. Later, we'll speak with Andrea Smith from the Coalition for Children's Behavioral Health about the impact on schools and how this is all affecting kids. Plus, Amanda Freese from the Times Union joins us to start this week's show. I'm Dan Clark, and this is New York Now.
Today, the Senate majority will pass legislation.
We will pass a law prohibiting it, and we will take them to court challenging it.
Get another stand for New York.
Welcome to this week's edition of New York Now. I'm Dan Clark. It was 4 months ago this weekend that the first case of the coronavirus was diagnosed in New York. 3 weeks later, Governor Andrew Cuomo closed most businesses and said people shouldn't leave home unless they absolutely had to. We're now at the start of July, and some of the long-term impacts of the pandemic are starting to set in. One of them is a statewide mental health crisis, which we're going to spend a lot of this week's show talking about. But another is the damage done to the state's economy, and Republicans blame that on Cuomo, saying he fumbled the state's reopening. State Republican Chairman Nick Langworthy said this week that the legislature should remove the governor's emergency powers.
He's not a king. I mean, we need to have a legislature that gets back to work and does its job. I mean, what would the country say if Congress just decided it was going to disband for the year and let the president just decide what it is? That's called a dictatorship.
And Langworthy's not alone in that thinking. With me now is Amanda Freese, a State House reporter from the Albany Times Union. Mandy, thanks for being here.
And thank you for having me.
Anytime. So let's talk about Langworthy. He's basically saying that the legislature should take away the governor's emergency powers. What does he mean by that? And is there any chance of that happening? It seems like it would not happen with Democrats in control.
So when the legislature passed the budget back in April, it included these emergency powers that allows the governor to pass laws, issue executive orders that address the public health crisis. I believe that those powers are set to expire February, April of next year. Yeah, so it's about a year that he's been granted these powers. While there have been Democrats as well as Republicans who have criticized the fact that these powers are still available to the governor, there really hasn't been any legislative movement in order to address it. And certainly when it comes to both the Assembly and Senate leaders, they don't seem to have any appetite for going back. Obviously, there is that expiration now. So, with that set to expire at some point, I think everybody's kind of waiting and seeing, especially because the public health crisis hasn't ended. And that's been a lot of the reasoning behind continuing to have these powers so that the governor could act quickly in this public health crisis.
Do you get the sense at all that this is political? I mean, we have the state GOP chair, which is Langworthy, having this press conference about this. We have the governor responding and calling him a mouthpiece for Trump. Where are the politics in this, Mandy?
The politics are front and center with this one, I would say. You also see it on display fairly regularly now in the governor's daily briefings when he has them, criticizing the federal government for not acting quickly enough to provide more relief to state and local governments. So I think this is kind of just another angle that is being taken. And certainly when it comes to the governor's side of things, he sees it as, the GOP chair is essentially saying that the public health crisis is over and there's no need for these powers. So it's a little back and forth between the two of them, as well as other individuals who have decided to play a little bit of ball when it comes to politics.
Before I let you go, let's talk about the rent relief bill really quick. The governor signed it this week. Give me a brief explanation of what it does and what renters should expect.
So I appreciate you asking that question because I've actually received, response from readers who were a little unclear of it. And this is specifically, it ensures that no tenants who have not been able to pay their back rent during the coronavirus pandemic and the restrictions for businesses will not be evicted. So landlords can still recuperate that money. However, it cannot be used as a reason to evict a tenant. So that aims to address the potential looming housing crisis if folks aren't able to, afford the rent and face eviction.
All right, Amanda Freese from the Times Union, thanks as always for being here.
Well, thank you.
Turning now to the state of mental health in New York. Experts say the country is heading toward a mental health crisis because of everything that's come out of COVID-19. Some have lost people to the virus, while others are coping with an enormous amount of stress from the pandemic. But things could get worse. New York is considering cuts to mental health care providers without aid from the federal government. I spoke with Assembly Mental Health Chair Aileen Gunther about what that would look like and what it would mean for the people of New York. Assemblywoman Gunther, thanks so much for being on New York Now this week.
Well, it's great to be here, and I'm very honored that you asked me to talk about mental health today, something that as a nurse and as somebody that has worked with a lot of the mental healthcare agencies, that we know that we've been long starved, and I think the COVID virus has brought this really into the forefront about how mental health hasn't really been supported the way it should be.
So I want to talk to you about mental health and COVID-19, but let's talk about the state of mental health in New York State overall first, because as you and I both know, funding for mental health services really wasn't as much as it could be before COVID-19 struck, and now we have this big budget deficit in New York State already. Talk to me about the state of mental health in New York State pre-COVID and how the disease has changed that.
So what I would say is that for a very long time, mental health, they recognize the need for health care, but part of health care is mental health. And we have been financially starved for years. If you have private insurance and you have psychiatric coverage, it's minimal. And often the co-payment is exorbitant. When we have a patient, and I've had a lot of parents that I've worked with over the years, that their child needed an inpatient stay. Like any other medication, you have to start a medication and observe the efficacy of that medication. They have these children in and out in no time short. They only collect the money, but we really don't see how effective the medication is. So the length of time is too short. The insurance companies charge a very high premium. We don't get the care that we need for our children, for people that are suffering from mental health. And hello, Governor Cuomo, the President of the United States, we are now at a time that we're going to see more and more people traumatize our children in school that haven't been in school, that are sometimes home alone, that they don't have food. We're going to need psychiatric care, mental health care, counseling more than ever in our schools, in our communities, everywhere. In our workplace, we need it. And you know what? I've been yelling and screaming for years, and I know I sound emotional, but it's just not fair.
You know, the mental health of, I would argue, everybody has taken a toll during the COVID-19 pandemic. But I think that's especially true for frontline workers and especially healthcare workers that have had to treat these patients coming into the hospital, see unprecedented amounts of death just right before them on the job. And that's going to take a toll on their mental health. You have a bill that would form an advisory council that would look at the mental health of essential workers. Tell me how that would work and what they would be looking at.
So I think it's important to create a collaborative group so that we have input, number one. But when I say let's create it, I want to create it and then get recommendations, and I want a timeline so that it doesn't go for a year, a half a year. Really, we need to really address this problem right now. And I think the only way that you can get the kind of treatment that folks need is by having a collaborative group that work in different areas that have input into a system that we could create that would really be holistic and serve the population of New York State. And especially now, it's the healthcare workers, absolutely. The death, the dying, the support of families. And so they need some help right now. And I think Governor Cuomo We need this money right now. We don't have to give any more exemptions to big business, to companies. We don't have to create startup companies, because right now there's money that we have in economic development that we're not going to be able to use, because at this point we're at a standstill. So take this money and put it someplace that will help the people that are suffering right now, that are children who may suffer in the future, that will never get over this, that are going back to school and don't know what it looks like. We need social workers, we need nurses in our school, and we need mental health in our school, and we need to do it right now.
Right, the state is facing this multi-billion-dollar budget deficit. It was before the COVID-19 pandemic even happened, and this has just made things worse. How do you get the message across that the state should preserve funding for these mental health care providers when Governor Cuomo is looking at cuts across the board everywhere?
Through people like you that will put this and talk about it till you're blue in the face. Not just me. Talk about a family member that is suffering right now and has the person at home and sometimes doesn't have the access to the medication they need. There is no exception. It doesn't matter if you're rich or poor. Children are scared. I'm scared. You're scared. I mean, it's just a really hard time for all of us. And Governor Cuomo, the Senate, the U.S. Senate, the U.S. Congressperson, please bring money back. No, not just talk. Let's have action. You know what? The public is sick of cheap talk. We need action, and we can't wait this time.
You know, before I let you go, you represent a part of the state in the Hudson Valley that we don't hear too much about too often. We hear about cities like Albany, of course, New York City, Long Island, Buffalo, the major cities around the state, but you represent a part of the state that's sometimes forgotten. Tell me about the state of your district right now and what your community is experiencing.
I mean, they're experiencing job loss, hunger, family loss of life. People sometimes have this vision that you see trees and you can breathe fresh air, that things are all right. Well, they're not all right. They're not all right. We have homeless. We have people living in dire conditions. We have children that are hungry. We have kids that we feed every Friday afternoon. Our teachers have a backpack program and send food home for those children. Where is our, I've tried and I'll continue trying. I know, don't give up. But you know what? When we talk about the Hudson Valley, we're up here. We are the people that are suffering with, at this point, people's loss of jobs, no transportation. You name it, we got it.
All right, Assemblywoman, thank you so much for your perspective on this. I really appreciate it.
Thank you so much for listening to me, and I certainly appreciate it.
So as things stand right now, New York hasn't made any major cuts to mental health services, but those providers are already thinking about how those cuts would impact them and the people they serve. Glenn Liebman leads the Mental Health Association in New York State, the leading advocacy group for mental health issues. We spoke about how prepared the state is right now for a mental health crisis and what it needs moving forward. Glenn, thanks for being on New York Now this week. I appreciate it.
Thank you, Dan. I appreciate being on.
Anytime. So I keep reading about a mental health crisis that's coming in the aftermath of COVID-19. And given especially the protests we've seen after George Floyd, there's a lot that is taking a toll on people's mental health. In your opinion, because you look at all of this being from the Mental Health Association, is the state ready for a mental health crisis of this size?
I don't think that anyone is ready for a mental health crisis this size, frankly. I think that New York has probably done better than any other state in terms of talking about it and identifying resources, but this is cataclysmic. And I don't like to, start screaming the sky is falling, but I've been doing this a long time, and we are sadly in the perfect storm right now between, as you said, Dan, between everything going on and the issues that we will face around trauma and anxiety and depression and addiction disorders. It's going to be enormous. It already is. We're seeing this. And the resources we need to garner are incredible. And we are talking about something in terms of especially the trauma, because the traumatic impact of this, and we at the Mental Health Association deal with, from people who are seniors to young children, and you see this as a global crisis that impacts every age group in different ways, but it impacts everybody. So we are very concerned.
Just for context, how does New York State compare in terms of its investment in mental health services and the accessibility of those services statewide compared to, every other state in the country? I'm assuming that we must vary compared to other places.
We do, and I would say, and a lot of it is anecdotal, but I would say that we stand above virtually anybody in terms of the resources that we allocate. One of the issues that we continue to say, though, and we have a more robust system than most states. That said, is still obviously a lot of issues and a lot of disconnects going on. Unfortunately, the way our system started in New York State was much more institutionalized based. So much of the funding traditionally went into the state institutions and less so for community services. Well, as the institutions have closed, yes, we've had reinvestment and that money is being reinvested into the community, but it still kind of underscores the need for even more community funding and less funding in terms of the institutionalized side. And we need to see more of that funding going into the community. So we are, yes, are we funded better than virtually any state? Probably. But are we underfunded compared to the need? Absolutely.
Speaking of funding, the governor is warning that he may have to make budget cuts across the board if the state doesn't get aid from the federal government due to the lack of revenue from COVID-19. What does that mean for the future of mental health services in New York State? I mean, you're already asking for more money, more investment in these community services. If there are cuts across the board to the state, what does that mean for these services going forward?
Well, Dan, we have advocated strongly. Obviously, our number one advocacy strategy is a national strategy to try to make sure, working with our national organizations and with our senators and with our congressional members, with our House members, to make sure that New York, obviously in the next stimulus package, is well funded. That aside, worst case scenario, that does not happen. We're advocating that when the cuts do occur, that the governor not do it in traditionally the peanut butter spread where it's cut across every agency the same amount, that we are asking for more targeted cuts, and those targeted cuts should not be around mental health or around human services, in particular behavioral health, because the impact of something like that is, yes, is it felt in every corner of the state in every way? Of course. But is it felt more in terms of a mental health crisis, a behavioral health crisis? Absolutely. So to deal with everything we're dealing with now, and the governor's been very outspoken. He's been terrific in terms of being outspoken about the need for mental health services and talking about the crisis numbers and all the resources that we're garnering. But we can't go back now and face cuts. It would be devastating already on top of what we're seeing in terms of the crisis.
You and a coalition of other groups have pushed for something called 345, which is a 3% increase in the human services sector over the next 5 years. It didn't happen in this year's budget, if I'm not mistaken. Do you think that, given the loss of revenue to the state, it has slowed the momentum of that push? Or is there a way that you can convince the governor and the legislature to, get that point across, that 3% is needed over the next 5 years?
I think we were going in a positive direction. We had really garnered, this was historic, Dan. We had gotten every human service agency in the state, every statewide group to work together. I don't know the last time that happened. And unfortunately, as we know, COVID hit. So we don't know what would have happened had there been no COVID. I think we were garnering enough momentum that something would have changed, because I think we were making a very rational argument as to the need for human services. We will continue the fight. Maybe it will be restructured in a different way, but I think in terms of the human service coalitions working together, all of us working together, we're not going back from that, because I think it's too important a message that we have to share.
All right, Glenn Liebman from the Mental Health Association, thanks so much for being here.
Thank you, Dan. I appreciate it very much.
Children have been caught in the middle of all of this since March. Not only have schools been closed, but kids struggling with their mental health have also been cut off from in-person services. And the state is now warning that cuts could be coming to both schools and community-based providers that treat those children. That could have a major impact on how kids deal with their mental health in New York State. Ryan Jones sat down with Andrea Smith from the Coalition for Children's Behavioral Health.
Andrea Smith from the New York State Coalition for Children's Behavioral Health. Thank you for joining me.
Thank you. Happy to join New York Now and keep up to date with what's going on in children's mental health.
Andrea, the State Education Department has formed a task force to handle reopening schools, and you're on that task force. The academic side of reopening schools, of course, is very important, but so is the behavioral and mental health of children. How do you think the decisions that will be made and the steps that will be taken for reopening schools, how do you think that will affect the behavioral and mental health of children?
Well, we know that children are feeling isolated. There was a recent article where an 18-year-old in a single interview used the words fear, afraid, scared, or terrified over 18 times. So we know that what has happened to kids has been challenging. And so when schools reopen, we have to be able to address those basic safety and well-being feelings before kids are really ready to learn. And so I think the toughest part is going to be, when teaching is your profession, putting that aside until everyone's ready to learn again. And we have to be doing that from day one, rebuilding trust and rebuilding relationships and working through anxiety before any learning can really occur.
So budgets and finances are a big talking point for a lot of institutions these days. And Governor Cuomo has said without federal aid, there could be cuts to the education budget in the state. Mm-hmm. How do you think those budget cuts would affect the behavioral and mental health services that are offered to children in schools? Would that lead to the elimination of counseling positions?
So there are positions inside the school, and there are community-based organizations that work with children and families after school or in their homes. And every resource is going to be needed to address the needs, the emerging needs of children. So the budget cuts cut both ways. If school budgets are cut, the additional transportation to achieve social distancing is impacted. The additional teachers that would be needed to keep the classrooms smaller so that there are fewer kids in the classroom at any time. And then if the community-based organizations are cut, all of the supports that we need to seamlessly keep the kids safe in, say, out of school time programs, after school time programs, so they're not home alone if they're on a remote learning day, or the mental health services that go in, pushed into the schools to run a school-based mental health clinic or to train teachers about post-traumatic stress and trauma-informed learning. All of those resources will be impacted. So right now, we are very much focused on making sure that school districts are included in federal economic stimulus aid, because they are going to need more money to teach in a socially distant, appropriate way. And just like community-based organizations are going to need more money to be able to expand this number of kids and serve the number of kids that are going to present as needing services.
And this need for federal aid, it's gone beyond schools. It's even affected the Office of Mental Health, which has put some grant funding on hold. You wrote a letter to Governor Cuomo, and you are asking for that grant money to be freed up. How much money are we talking about?
So we're talking about a lot of money, but let me say that the governor's office did notify us on Friday that the July 1st state aid to mental health providers will be released. And we are so relieved that the state budget office and the governor's office has prioritized that funding. We think that it will be about $70 million that will flow into counties and then from counties down to community-based organizations. And we do believe we were heard, and that funding will come through. Thank goodness.
Now, will that mean a full complement of services? Will that be enough to make sure all of the services that have been provided in the past will be accounted for going forward?
No, I mean, that really will just allow us to keep the local grant programs running. Most of our funding is through Medicaid, and there's another federal disbursement that we're waiting on. It was recently announced that the federal government was going to make $15 billion available to eligible Medicaid providers. That's the funding that will be needed to keep services whole, because we lost revenue as a result of COVID, and then there were hundreds of thousands of dollars of additional costs to be able to do telehealth services. So we're covering a lot of ground in that answer, but we need that federal money.
Andrea Smith, thank you so much for joining me today.
Thank you.
If you or anyone you know is struggling with their mental health, check out our website for a few links. Until then, I'm Dan Clark. Thanks for watching this week's New York Now. Have a great week and be well.